Welcome to the Mental Health Emergencies module of this series. Mental health emergencies is one of the smallest areas on the exam when you look at number of questions. It only makes up 11 questions on the exam, or 7%, which I'm going to guess a lot of you watching the video are probably like, thank goodness, because as you know, most of us struggle with caring for the patient with mental health disorders. You know, it's not necessarily the easiest type of patient to care for, and certainly the emergency department is often not the appropriate environment. So they create challenges for us, and it often, is not the area that we all love. I love, though, when I work with nurses who enjoy mental health patients, because that means that they can do that part, and I have to do less of it. But as difficult as it is to manage the patient with mental health emergencies in the emergency department, this is a population that really was dealt an unfair hand of cards in life. And as difficult as it might be to manage them in our environment, which isn't designed for it, the amount of sympathy and empathy that these patients deserve is phenomenal. So I'm just going to start out my lecture, with that introduction. My heart does break for this population who often just struggles to make it through everyday life with the disorders that they have. So with that being said, we're going to start with our first challenge question for this section. Are you ready? A patient presents to the ED in the manic phase of bipolar affective disorder. Which of the following statements made by the emergency nurse is most therapeutic for a patient with this diagnosis? A, I want you to tell me what you're feeling right now. B, I need you to stay in this room and someone will stay here with you. C, tell me what's going on in your life right now that may have made you feel out of control in the past few days. Or D, we are worried that you might be a danger to yourself or others in your present state. So we're going to have somebody from psychiatry come down and discuss with you what you are feeling. Which of those is most therapeutic? Now, I'm going to give you the answer in a little bit, but let's cover the theory behind the question. So let's talk about thought disorders. So we're really talking about patients with psychosis. A psychosis is an alteration in reality, where somebody's reality is not the same as everybody else's. I mean, let's say that I'm, having a party at my house, and I live in Portland, Oregon, so I'm having this party in Portland, Oregon. If everybody at the party is at a party in Portland, Oregon, then we're probably none of us are psychotic. But if somebody at my party thinks that they're on a spaceship flying in space, while the rest of us think that we're at a party in Portland, obviously the patient on the spaceship is psychotic. Now, if everybody at the party thinks they're on a spaceship and I think I'm at a party in Portland, Oregon, then probably I'm the psychotic one. So whoever's reality is different than everybody else's tends to be the psychotic patient, or has a thought disorder known as psychosis. Now, there's really three main causes of psychosis, and they are schizophrenia, delirium, and then your mood disorders, including depression and mania. And each of these is going to present a little differently, so I want to kind of look at them independently. So let's start with schizophrenia. So schizophrenia is a thought disorder that's a chronic disease. Once you have it, you can't get rid of it. We can certainly control it with medications, but you can't get rid of it. It usually begins in late adolescence, or at the latest, it may begin in the 20s. It rarely ever starts over the age of 30. So if you're already 30 or older, you can check that off your list of things to worry about. You're usually going to see schizophrenia show up in adolescence for most people. Schizophrenia is marked by bizarre thoughts and behavior, often suspicious behavior, as well as social awkwardness, even when not psychotic. Now, the symptoms of schizophrenia are sometimes divided down into two categories. One is positive symptoms and the other is negative symptoms. Here's my honesty moment for you. I could not understand this positive and negative symptoms forever. And so for the first few editions of the course, I never taught it, because you're not supposed to teach things you can't understand. Well, I finally came to grips. I understand positive and negative. So let me see if I can teach you in 30 seconds what took me about 5 years to learn. What is a positive and a negative symptom of schizophrenia? Positive symptoms are symptoms that the patient with schizophrenia has, but the rest of us don't have. I am not schizophrenic, so I will not have the same symptoms as the schizophrenic. And the symptoms that they have and I don't are called positive symptoms. The easy example here is hallucinations and delusions. The patient with schizophrenia has those, I don't. So because they experience it, we call it a positive symptom. They hallucinate, they delude. They may also have disorganized thoughts. They often perseverate. Now remember what perseveration is? To constantly focus on the same thought. So they keep coming back to the same thought. Even though you try to move them to a different thought, they keep coming back to the same thought. They often have ideas of reference, and they tend to be ambivalent. So those are symptoms they have. I don't have them, so they're positive. Now what's a negative symptom? A negative symptom is something that I do as a non-schizophrenic, but they fail to do. So when they don't do it, then it becomes a negative symptom. Let me give you an example. Apathy. I care, they don't. Alogia. I speak, they don't. Flat affect. I have emotion, they don't. Anhedonia. I feel pleasure, they don't. Avolition. I finish a task, they don't. So the things that I do but they fail to do are negative, and the things that they do and I don't are positive. How confusing is that? But I hope in that short time that I was able to help make that clear what a positive and a negative symptom of schizophrenia are. And those are the main symptoms that patients with schizophrenia will exhibit.